How's it going? It's Dr. Greg Marin here at One Spine Chiropractic. Today we're going to be discussing a condition called plantar fasciitis. And plantar fasciitis we see quite often here in office, but just because it's common doesn't mean it's normal. So you actually want to go see a professional and get some treatment about it. The cool thing about plantar fasciitis is we get great results by doing chiropractic care, laser therapy, gua sha therapy, soft tissue supported therapy. So what we want to do today is we're going to demonstrate how chiropractic adjustments to the foot help relieve some of that plantar fasciitis pain we're having. So what happens with the foot is we want the bones in the foot working properly so they can function and feel well. A lot of times when we have a bone that's stuck or we have an old injury, it makes the foot adapt and not work the way it needs to. So it's affecting the arches and the heels and things like that. So we're going to demonstrate how getting this foot adjusted lets things function properly, but more importantly, move the way we need to prevent further injury as well. So today we're going to be adjusting the ankle joint, and we're going to be working on the talus right here. So what we're going to do is grab the talus in this position here, slowly pull here and let the patient relax. Good job. So getting that ankle joint adjusted helps everything function better and move better. Okay. So the next bones we're going to work on are going to be the navicular bone and the cuboid bone. So these bones are work on the arch of the foot. So a lot of times when the bone drops out of place, the arches don't function well. So what happens is we have issues with the bottom of the foot with the tendons where it's causing that plantar fasciitis and some irritation. So we're going to work on the navicular bone right now, and we simply get that in the position where it needs to be. Good job, good pop. All right, so the next bone we're going to be working on, like we spoke about, is the cuboid bone. A lot of times when that bone gets misaligned, it causes a lot of lateral pressure on the foot and down that lateral tendon there. So we're going to get that bone back in place today as well. So we'll just go back out here. Get that here, a little tug. Awesome, perfect. So like we spoke before, when the bones are in place, things function properly. There's less pain, less injury, and more importantly, the tendons that go from the heel down the foot are less irritated. So that plantar fasciitis pain that you might be experiencing goes away. So what happens with One Spine Chiropractic is we go the extra mile. We want to figure out why the foot's hurting. It might be a discrepancy in your hips. Your gait might be off. So what we're going to do here as well is we're going to actually adjust the pelvis so your gait's right and the plantar fasciitis won't get inflamed or reoccur or re-injure itself. So what we're going to do is evaluate, make sure one leg's not shorter, one pelvis is not rotated, so we'll get you adjusted from head to toe and let things feel better and heal better as well. So it's going to have the patient go on her tummy for us. And then what we're going to do, first of all, if she was a new patient, we'd have done a thorough progress exam and done some x-rays maybe, but we're going to do an evaluation to make sure one leg's not a little shorter. So we do see a short leg, that is telling us the pelvis is rotated. And when the pelvis is rotated, your weight issue might be all causing some compensation. So we're going to get that adjusted by getting these bones back in place here. Perfect. So we're going to remeasure, make sure these feet are lined up properly. They are nice and straight. So chiropractic care helps with pelvis, the foundation, getting the foot worked on properly so the biomechanics work and there's less pain in the foot, less plantar fasciitis, and less irritation. So if you need anything for your plantar fasciitis, call us at One Spine Chiropractic, 993-1001. Thank you.